So for hand, wrist, finger, thumb tests, they're going to be really all iterations of the same similar test. So we're going to be testing really valgus and varus for the collateral ligaments of each joint. So for our valgus stress test, we're going to be testing the ulnar collateral ligament and the TFCC here on the ulnar side. And we're going to describe this in anatomical position so their palms are facing up. And what we want to do is stabilize here at the forearm and stabilize here at the forearm, grab a hold of the hand, and we actually want to radially deviate the wrist. So we're applying a valgus force essentially. We're pushing here on the lateral side inwards, so medially, while pulling the hand outwards, going into radial deviation, so towards the radius. Really just trying to open up this side of the wrist and test the ulnar collateral ligament of the wrist and the TFCC. For your radial collateral ligament of the wrist, we're going to do a varus stress test, so just switch your hand position, stabilize at the lower forearm, grab a hold of the palm, and then we're going to ulnarly deviate the wrist. So we're going to apply a varus stress out towards the lateral arm while we're pulling the hand in medially, really trying to open up this area here and test that ligament, that radial collateral ligament. Pain or laxity at either would be a positive sign. For carpal tunnel syndrome, you do Phelan's test. You're going to ask the patient to flex their wrists and press them together like this, and they'll be asked to hold that position for a minute. If they report any pain or tingling, numbness in their hands, fingers, wrists, they might have carpal tunnel syndrome of the hand. People that have really severe carpal tunnel will report those types of symptoms very early on. You probably won't have to hold out for an entire minute to find out whether or not they have carpal tunnel. For thumbs and fingers, the thing that we're going to be doing is essentially valgus and varus stress again. For the thumb, it's more common to sprain the ulnar collateral ligament rather than the radial collateral ligament here. But you can easily test both simultaneously. Stabilize right below the joint in the scaphoid area, so where the anatomical snuff box is. You really want to grab a hold of that metacarpal so it's nice and stable. Make sure your thumb is in a neutral position. You don't want it to be too flexed or extended. And then with your thumb, you're just going to simply apply the force here to open up that joint and test that ulnar collateral ligament. Any excessive laxity or pain will be pretty noticeable. It will be very painful to go in this position, and excessive laxity, their thumb will move quite a bit. For the radial, just keep that same hand position, and using your finger here, just move the thumb in the opposite direction towards you, or basically bending it towards you to test that radial collateral ligament. For fingers, at the joints for both the proximal and the distal phalange, we want to test the collateral ligaments by applying a varus and valgus force on either side. So really just stabilizing above and below the joint and applying the force accordingly to see any laxity or pain. And that will be the same for all of the interphalangeal joints. If you suspect a volar plate injury from a hyperextension of the finger, then you can simply just stabilize here at the proximal phalange and then slowly extend, and usually they'll report pain on the underside of the finger. Oftentimes with volar plate injuries, it will be nice and swollen in that pocket, so it will actually be hard for them to extend and be quite painful. And that was how you would test the fingers, the hand, or the wrist, and the thumb.